Yes, my name is Dr. Agyenim Akuamoah-Boateng. They all know me as Dr. Boat, B-O-A-T, Dr. Boat. And I've been in this community since 1998. And I think I've pretty much worked with almost every family when it comes to mental health and substance abuse issues. I'm the program director and clinical director of my own intensive outpatient mental health and substance abuse treatment program here in Laurinburg, North Carolina. And we serve several communities, including the Skyline County and the surrounding metropolis, including Robeson County, Hope County, Moore County. So we have clients coming from all over seeking mental health and substance use disorders treatment. Like I said, my program is, or my clinic, we provide outpatient mental health and substance abuse treatment program. We have what we call the SAIOP, or the Substance Abuse Intensive Outpatient Program. We do couples therapy for chemical dependent families. We also provide psychiatric services, which is contracted. And we provide SAP, DOT, and DWIS services. Well, in short, when it comes to mental health and substance abuse, we are here to help you. We are here to help the community. And I'm very proud to be given the opportunity to serve this very, very, very nice community. I just want to express my condolences to anybody who has lost a family member because of this COVID-19. Before even I get into the services we provide, especially in this very challenging time, I just want to say that anytime they talk about pre-existing condition, when it comes to COVID-19, what I hear is diabetes, asthma, high blood pressure. Seldom do I hear people talk about mental health and substance abuse. But trust me, people are dying from mental health and substance abuse as a pre-existing condition when they develop or when they contract this COVID virus disease. Why? Because assuming someone is an alcoholic and the person has COVID-19 and is going to be put on a ventilator and the person is going through withdrawal, and we all know that alcohol withdrawal can kill you. But then how often do they even interview the person or the family and realize that they need to detox the person, probably medically, as well as providing the treatment for COVID-19, which means somebody can die from alcoholism as a pre-existing condition when they have COVID-19. So yes, we have had, I never thought that we'd be even busier than when we were seeing people in the office. Of course, because of the executive policies going on and the fact that we are in a state of emergency and offices are closed, we are doing something called telehealth. Telehealth, which means we use video, the phone, virtual in seeing folks. We still do assessments, we do intakes, we do everything we did prior to COVID-19, but except that we do it via video or telehealth. We do groups, individual group, family. All those who need their medications can still see the psychiatrist or the PA for their medication. So nothing much has changed as far as we are concerned. The only change is that we don't see our clients or patients face to face, but we see them via video. We can refer them to the rehab. We can refer them to the hospital for detox. So we are even busier now. And what do people do when they have anxiety and depression? They always self-medicate. And when they self-medicate, what do they use? Drugs and alcohol, and I mean illicit drugs, marijuana, cocaine, and stuff. And we live in a community where there's something called the dog food, which is killing people. One of the dog food is the heroin, the fentanyl, and all those stuff that is being used. So yes, We are busy. We are monitoring our phones. Sometimes I can stay on the phone all day calling everybody in my program to make sure that they are doing okay. Just call. Sometimes they are surprised that I called. I said, I just called to make sure you are doing okay. How is the family doing? How are you doing? Sometimes it makes their day, because depression and anxiety will compromise your immune system. And we need our immune system to fight the virus. So more than ever, mental health and substance abuse treatment is needed more than ever, because once you are depressed, when you have anxiety, you secrete a stress hormone called cortisol. Cortisol is a stress hormone that can compromise your immune system. And then when your immune system is compromised, you can't fight the virus. And so you could see how important our job is now in the midst of this pandemic. Basically, what we do is once you call us, either my secretary or any of the staff at the office will take your call. We'll do a referral or a screening. The screening means we ask you, we try to find out what is going on with you. Is it mental health issues, substance abuse issues, or both? Because nowadays, you don't get people coming with just mental health or mental illness. It's either a combination of mental health and substance use disorders, or medical mental health and substance use disorders. In fact, I recently wrote a dissertation, a 129-page research paper, which you can find on Google Scholar, on integrated medical mental health and substance use disorders treatment. So when they come, we figure out what the issue is. Then we diagnose the person. And what we are doing now is integrated care. Integrated care means if you come in, you have a back pain, severe back pain, you are abusing opiates, drugs, and alcohol. Then what we do is that we make sure we refer you to a doctor who will treat your medical problem. And then we will work collaboratively with the doctor who is treating you. Or if we feel you need a detox, we refer you to a place like Monarch at Tanglewood in Lumberton, where you undergo detoxification and stabilization. And once you are done, you are referred back to us, and we do what we call aftercare relapse prevention treatment. Or if you come in and you have an issue with opiates, like Lorcet, Percocet, Darvocet, and all those sets, I call them, heroin and stuff, then we will refer you to an agency or a treatment program that provides what we call MAT, or medication assisted treatment. That agency or that clinic may prescribe you Suboxone. And the Suboxone is a combination drug of naloxone and buprenorphine that will take all the cravings and everything away. But the manufacturers of this drug, it in combination with psychotherapy. So you are referred back to us, and then we provide the treatment for addiction, which means you are getting your treatment for the, which we call the physical dependence, which treatment for the opioid addiction, and you're also getting treatment for your psychological issues. So what we are doing is called collaborative care. We are collaborating with other treatment agencies. We are collaborating with doctors. We are collaborating with pain and spine clinics. We are collaborating with medication-assisted treatment programs where they can get their Suboxone. So right now, the treatment we are providing is called integrated care. You don't come to my office and I will say, well, I'm just going to talk to you about alcohol or drug, and I'm going to ignore the rest of them. No. We will take care of every issue, and the one that we are not able to provide at our office, we'll make sure we refer you to the appropriate agency that will work with you. But then we don't stop there. We work collaboratively with that agency so they know what we are doing and we know what they are doing, and it helps very well.
Okay. So now, Dr. Bowe, it sounds like each individual has an personalized treatment plan.
Exactly.
Now once they leave I need the services, yeah.
All right, thank you for asking. Well, in my intensive outpatient program, we also have a regular or basic outpatient program. So the intensive is most of the time it's a 12-week program, which is 3 months. So the 3 months, you get individual, group, family, and psychiatric services, which means we don't just focus on you. We focus on what is happening in the family. If you have any relationship issues, couples issues, we take care of it. We also put you in a group setting whereby you meet other individuals who are having the same problem as you have, and then we do groups 3 times a week. I have contracted with a psychiatrist who comes to my office, and so you also get psychiatric services. And then if you need medication for your anxiety and depression, because you just cannot treat someone who has alcohol or drug use problem, who also has depression, and ignore the depression or ignore the anxiety. So my program is more like a dual diagnosis program, which means we treat people who have dual diagnosis of mental health and substance use disorders. We treat them both simultaneously. But then what happens is that, like I said, if we feel like you don't need to start on our level, and of course, let me finish this. So once you are done with the intensive part, we step you down to the less intensive, we call it the aftercare program. We provide transportation. So transportation will not be a problem for you to come to Manpo. We have 2 big vans. Wherever you are, we'll come and pick you and bring you in and take you back home. But then if all fails and we feel like you don't need to begin on the outpatient side of the program, then we will reassess you and recommend appropriate level of care. And that appropriate level of care may be a residential program, which we call rehab. Rehab means we may refer you to a residential setting whereby you may go for from 28 days to sometimes 9 months or to 2-year program, which means we take you out of the community and place you in a residential setting whereby you get the needed help before you transition back into the community. So the treatment is called person-centered plan. We tailor the treatment plan according to each person, because you can't find 2 individuals who have a history of substance use disorders or mental health issues or addiction who are the same. No, each person is different. Thank you, and may God bless.